Hello lovely parents. Today, we're diving into hand, foot, and mouth disease, a common viral infection that can be a bit scary for new parents, especially when you first spot those red spots and blisters. We'll cover what causes HFMD, tips for soothing symptoms at home, and the warning signs that might need extra medical attention. Let's get started. Hand, foot, and mouth disease, HFMD, is a common viral infection that affects infants and young children. It's known for causing sores in the mouth and a rash on the hands and feet, which can sometimes look alarming to parents. The illness is usually mild, but it's helpful to know how to treat the symptoms and recognize signs that may need medical attention. HFMD is caused by viruses like coxsackievirus, which spreads easily, particularly in childcare centers or preschools. This is why it's most common in young children, though it can affect older kids and adults too. Symptoms of HFMD start with a mild fever, reduced appetite, and sore throat. As it progresses, red spots or sores appear in the mouth, making eating or drinking uncomfortable. A rash may also develop on the palms, soles, and sometimes other parts of the body. These spots are typically flat or slightly raised, and they can turn into blisters over a few days. The symptoms generally last about a week to 10 days. For most children, HFMD goes away on its own without the need for any specific medical treatment, but managing symptoms at home can make your child feel more comfortable. Make sure your little one gets plenty of rest, stays hydrated, and eats soft, mild foods. Cold foods like ice cream or popsicles can soothe sore throats and mouth ulcers, and a fever can be managed with children's acetaminophen or ibuprofen. Just remember to follow dosage instructions and avoid giving aspirin, which isn't safe for young children. Rinsing the mouth with a gentle, saltwater solution might help ease the pain from sores as well. Keep your child's hands clean, and try to prevent him from scratching any rashes or blisters to avoid infection. As you monitor your child's symptoms, it's important to be aware of a few signs that might indicate more serious issues. In rare cases, HFMD can lead to complications like dehydration or infections in the blisters. Dehydration is a risk when a child finds it painful to swallow, and a high fever that persists beyond a few days could be a sign of something more severe. If your child is having trouble drinking, has a high fever for more than 3 days, or seems extremely irritable or lethargic, it may be time to contact your healthcare provider. Also, if blisters become pus-filled or red, these might be signs of a secondary bacterial infection, which would require antibiotics prescribed by a doctor. Preventing the spread of HFMD can be challenging, especially in environments where young children are in close contact. However, regular hand washing, disinfecting toys and surfaces, and encouraging children not to share cups or utensils can all help reduce the risk. If your child has HFMD, it's best to keep them at home until they've recovered, as they can still spread the virus for a few days after symptoms go away. While HFMD can be uncomfortable, knowing what to expect and how to treat the symptoms at home can go a long way toward a smoother recovery. The best approach is to keep an eye on your child's comfort, provide plenty of fluids, and watch for any signs that might need further medical attention. This phase will soon pass, and with some good care, your little one should be back to normal in no time. Thanks for tuning in. Remember, while HFMD can be uncomfortable, most cases clear up on their own with some extra TLC at home. If you found this video helpful, please give it a thumbs up and subscribe for more baby health tips. Let's keep our little ones happy and healthy. See you in the next video.